Does anybody have any comments?
We had one comment from the public.
So, Peggy, we had one comment from Ken.
Do we want to read it?
Yeah,
Yeah,
and I know about that one.
Okay.
I'm
Well,
worried about people coming from outside the county.
We
Okay.
have one. Where is it? We had one from Carol Lindahl. You want me to read it?
Sure.
Okay. I am respectfully writing in support of Mason County's application for variance to move sooner from phase 1 into phase 2 of the governor's plan to reopen. As it appears there is a relatively low rate of COVID-19 in our county, I think any unnecessary delays in moving forward could result in further harm to both the health and economic well-being of our county. I am concerned that the longer small business are prevented from opening, the more likely it will be that some will never open their doors again. Mason County already seems to be at a social and economic disadvantage compared to other larger, more affected counties across the state. The community needs to be supported in efforts to try to recover now, especially given that there may be a need to respond to outbreaks again in the foreseeable future. I believe wise leadership, which is responsive to the needs of all of its citizens, will result not only in greater support for such leadership, but also hopefully a healthier and more united community. Thank you for your leadership and welcoming the input of citizens in this difficult decision-making process. Sincerely, Carol Lindahl.
And Madam Chair, if you don't mind, we still should read his letter into the record. Do you mind if I read that?
Oh, no, that's great.
Okay, Ken Van Buskirk also wrote in saying Mason County should carefully consider what the impact might be if we open the county too soon and have a surge in tourism with a potential surge in COVID-19 cases. History has a way of repeating itself. Thank you for all you do, Ken Van Buskirk, Belfair.
Okay. So is there any comments?
Peggy, would you like me to
Anybody?
Peggy, would you like me to do just a quick brief? Like a 2-minute brief on it? Okay. All right.
That would be great.
All right, so, when the governor first came out with his 10-county proposal, Mason County wasn't on that list, but over the course of the weekend just following that, they were open to receiving requests from 6 additional counties, which Mason County was one. So I took the governor's proposal for reopening the state and went line by line and addressed each one of those concerns and put together the proposal you see in front of you. The one place I did make changes was I went around the 3 weeks with no new cases and put it in a little more of a scientific basis where I look at cases per 100,000, you know, on the CDC recommendation, which is 0.77 cases per 100,000. Scale that down to Mason County, which comes out to 0.45 new cases per county or 64,000 people. And then looked at our data over the course of the entire outbreak, which brought us in at 0.38 cases per day. But in the last, if you take the last 21 days, and I don't have this, and we talked about it at commission this morning, so if we add another line in there that says over the past 21 days, our case count is 0.24 cases, I think it was 0.24, 0.23 or 0.24, rounded up to 0.24, cases per day in the county, which is well within our capability to do contact tracing and work with our hospital system. So that was the only change that the commissioners would like to see added to this. The process involves county commissioner approval, a letter from the health officer, a letter from the hospital, and then sign off from the Board of Health. So that's where we are at right now. This is the last of the 4 pieces, in which case I can put this together this afternoon and send it to John Weisman, Secretary of Health, and he said he would have answers for us within 3 days. Now,
That's really,
yeah, it is fast, and John has been very good to work with lately. I've been very pleased with working with DOH. As in phase 1, none of the categories in phase 1 or phase 2 can reopen until the state puts out guidelines regarding that specific business sector. So like last week it was car washes and religious services. So then as we go into phase 2, or get the approval to go to phase 2, we will still have to wait for those state recommendations for each industry sector before we move forward with each of those sectors. Just, I wanted to make sure that was clear out there.
And I liked how Dr. Stein stated in his letter that we're not gonna just willy-nilly let anybody open up. They have to be approved first.
So we do have the ability to be more restrictive than the state, and we certainly reserve that to ourselves.
Madam Chair, you have a hand
Other
up.
comments?
Thanks, Madam Chair. Just a quick question for Dr. Stein. Dr. Stein, appreciate everything that you've done along with the public health team on this. At our just concluded Board of County Commissioner meeting on this, I've mentioned one aspect of your letter that I had asked Dave and you to work on being a little bit more clearer on as this process unfolds, and that's in the letter you said we would use our local authority to regulate the safety of businesses. And so I just wanted to make the comment here, as well as I did in the other meeting, that that we should be communicating clearly with the community as to what the expectations are for reopening, and kind of spelling out where our authority comes from and the limits on that authority and actions that we could take, since they may differ from what could happen at the state level. And so I just wanted to be on the record here with that as well.
Thank you.
Madam Chair, would you mind if I make a motion?
Sure.
Madam Chair, I move for the adoption of the resolution approving application for COVID-19 Phase 1 to Phase 2. With the addition of the provision that the Commission supported earlier, and that Dave Wyndham brought forward, of the addition of the percentages.
I'll second. The House government is very much in favor of this proposal.
Okay, any other discussion?
I have a comment. As we were talking about earlier, I wanted to point out for ourselves and for the community that we do have the authority to be stricter than the state, but not less restrictive. And I wanted to let you know that in talking with Dr. Stein, I had made clear that if something happens, because I very much appreciate, this was a hard decision for him in our discussions. I know that he was really fighting with himself over this one, that I will be supportive of him if something does happen that we want to be more aggressive quickly. I personally will be supportive, and I, at this time, they'll be able to move forward. It's going to make a big difference in our community.
I would just piggyback on that comment as well. I think my support of this is contingent very much upon the work Dr. Stein and the hospital districts have been doing to get ourselves, from a public health perspective, ready to do this. I know there's been a lot of conversation with the business community, a lot of work on the long-term care facility side, but the one other word of caution is we do have a community that ranks higher in those comorbidities, and so we do have to still remain vigilant and watchful as we roll this out. And so I would just echo Commissioner Netherland's comments on that.
Okay, are you ready for the vote?
Aye.
All those in favor?
Aye.
Aye. Those opposed? Any abstentions? Okay, so I guess that's it.
Madam Chair, I move we adjourn.
For the
Second.
signature.
Oh, wait.
Oh,
I do have a question, because I know you want to send that today. Are all the board members okay if we just write for their signatures?
Yeah,
whether
you'll
via
have to do some
teleconference?
kind of signature for us.
Okay.
do you want that in the form of a motion?
No, that's fine. I know through all of this, we can sign their name and a note by.
Is there anybody that objects to allowing the county to sign on their behalf?
I don't. Everybody else okay with that? Okay.
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 This is Dr. Stein. Do you need something changed in the letter before submitting this?
I don't think so.
No. I just wanted us to be mindful of spelling that out. If this is approved, spelling that out for the community. So something just to keep in mind and work on, as I know you will. No, I thank you.
Thanks, Tom.
Okay, now I move we adjourn.
Second.
Yes, we're adjourned.